Hey everyone, welcome to this week's conversation with Dr. Stephen Nedd about the body and how to fix, protect, or maintain it using outside-the-box alternative solutions. If you're a big fan of the pharmaceutical or surgical approach, you are so in the wrong place, because on this podcast, we're not going to be pushing the conventional medicine methods or way of thinking about health. If you're looking for another way to live longer and healthier, join me, Ron Nedd, and my brother Dr. Stephen Nedd for this week's body chat about pain and natural pain solutions. Me? I'm a retired Twin Cities chiropractor currently helping people buy and sell homes in the Tampa Bay and Los Angeles areas. My brother has a thriving chiropractic practice in the Clearwater area of Tampa Bay, Florida. In this podcast, we're going to chat about all sorts of topics related to health, nutrition, exercise, just about everything having to do with the body. You're invited to listen in to our body chat, but don't forget that neither of us is giving you health advice, so don't rush off to do something without either checking with your doctor first or seeing Dr. Stephen Nedd as a patient at his office. Good afternoon, Steve.
Good evening, bro.
That's right, you're a different time zone. Okay, so this week we're going to talk about pain. So what are the different types of pain that a person can experience?
Well, let's start with the two major categories, acute and chronic. So acute is sudden pain that lasts for a short time and usually is the result of an injury. Childbirth labor pains also qualify as this. Now, chronic pain is very common, affecting approximately 100 million Americans, more than cancer, diabetes, and heart disease combined.
Wow.
And this lasts much longer than acute pain, usually at least 3 to 6 months. It can also be due to an injury, but more often than not, it's due to something that takes time to develop, like muscle tension from poor posture, spinal disc degeneration or herniation, arthritis, nerve impingement, or more serious diseases like cancer.
Okay.
Yeah. As far as the specific types of pain, those include achy, dull, sharp, stabbing, throbbing, and burning. So we're going to go through each of these.
You want to do that now?
Why not?
Okay, go ahead.
Yeah, so achy is pain that occurs continuously in a localized or generalized area with mild or moderate intensity and has similar sensations as heaviness or soreness.
Okay.
So a lower intensity example would be the way your body feels when you have the flu, and a higher intensity example would be a toothache.
Oh, okay.
Yeah.
That's good examples.
Now, like achy pain, dull discomfort occurs at a low level over a long period of time. However, dull pain may intensify when you put pressure on the affected area. So this would be like the residual pain after smashing your finger while closing a door on it.
Okay.
Now, sharp, when you feel a sudden intense spike of pain, that qualifies as sharp.
Right.
And sharp pain may also fit the descriptors cutting and shooting.
Yes.
So a good example of this is a razor cut.
Absolutely. That was what I was thinking too.
Yeah. Now, stabbing, like sharp pain, stabbing pain occurs suddenly and intensely. However, stabbing pain may fade and recur many times. So stabbing pain is like an electric shock type of sensation. And this would be like sticking your finger in a light socket, which I definitely would not recommend.
No. I agree with you on that completely.
Okay, good. Throbbing pain consists of recurring achy pains. You may also experience pounding, beating, or pulsing pain with this. So an example would be a headache in which you can feel a pulsing like heartbeat when you put your hand against it.
Okay.
And there's a long list of things that can cause burning pain, including injured or diseased nerves, muscle strains, shingles, narrowed blood vessels with restricted blood flow, ulcers, carpal tunnel syndrome, and even frostbite. So an example of this is putting your hand or finger on a frying pan, something I did when I was little, if you remember that.
No, I think I blocked that out.
Well, I don't know. I put my hand on the griddle that our dad used to make Sunday morning pancakes, and I screamed so loud I think I almost broke a window.
Oh, wow.
Yeah.
No, I don't remember that one.
Yeah, you probably weren't home then.
Probably. All right, good. So those are the different types of pain. So what would be an easy to understand explanation for why there's pain and how it's perceived or transmitted? Is there a way of describing that so it doesn't get too confusing?
Yeah, I'll simplify it.
Okay.
Well, in general, pain is a protective mechanism or warning signal that something is wrong with the body or that the body's in danger and you may need to take some action. It's completely a subjective sensation, and it's actually the most common reason that people seek medical attention.
Is it really?
Yeah.
Okay.
We have over 3 million pain sensors, also known as receptors, throughout the body, primarily in the skin, muscles, bones, blood vessels, and some organs, including the heart.
Mm-hmm.
And when the pain sensors detect a harmful effect or a stimulus, such as an impact injury or the extremes of hot or cold, they transmit a signal through our nerves, which are the power and communication cable lines of the body.
Mm-hmm.
These go to the spinal cord and then to the brain. So this is just like what happens when electric power runs from the switch through the wire to the light bulb in a lamp.
Okay. So basically, this is the warning system. It's kind of like the security system in a high security vault or one of those things in the movies where it's like you step on the wrong thing and all these red swirling lights go on and the guards come with their machine guns to cut you down and all that stuff like that. So the pain is basically there's a system in the body to warn you of something that's dangerous or that may be a problem.
Exactly.
Okay.
So the problem with this, with pain, is that when it's continuous in a loop, like a broken record between the body part and the brain, this is where people tend to turn to and oftentimes abuse medications to try to shut it off.
Mm-hmm.
But those are only designed for temporary relief instead of addressing the real cause behind it. So just remember, nobody's ever had a blood test come back saying they were low on aspirin, Tylenol, or ibuprofen.
Right.
So
that's a good point. And plus, pain, if it's a warning signal, trying to shut down the pain may not be a smart thing to do.
that's right.
All right. So then how are pain and numbness related?
Well, first of all, numbness is a loss of the sensation of feeling in an area of the body due to damage to or reduced function of the nerves that supply that area. So in simpler terms, it's the dulling or numbing of sensation in a nerve.
Okay.
And numbness and pain are related since both are the result of damage, irritation, or compression of nerves. And both can result from similar causes, including trauma, chronic diseases like diabetes and multiple sclerosis, and especially pressure on the spinal nerves due to things like disc bulges or herniations, arthritis, spurs, stenosis, which is narrowing of either the spinal canal or the holes where your nerves come out between your vertebrae,
Mm-hmm.
or very commonly what us chiropractors treat as subluxations.
Mm-hmm.
So one of the most common causes of numbness in the hands is carpal tunnel syndrome.
Right.
And you can find out more about that in our episode number 10.
Correct. We did go into a lot of detail about that.
Yeah. Another interesting cause of hand numbness is the deficiency of the vitamins B1, B6, and B12.
Really?
Yeah, any one of those can cause numbness
Mm.
in the extremities. Yeah.
Okay.
Now, one of the most common causes of numbness in the toes is diabetes, specifically diabetic neuropathy.
Not a good thing.
And this is caused by prolonged exposure to high blood sugar that can damage delicate nerve fibers, and it also weakens the walls of the small blood vessels, or your capillaries, that supply the nerves with oxygen and nutrients.
Okay.
Yeah. By the way, another similar sensation to numbness is tingling.
Right.
Yeah.
People often talk about having numbness and tingling.
Yeah. So the difference is tingling is a slight prickling or stinging sensation that's also described as pins and needles.
Right.
Yeah, and this is often caused by pressure on the nerves when you've been in one position for too long, such as sitting with your legs crossed or sleeping on your arm.
Mm-hmm.
And, it'll normally self-resolve very quickly. However, if you have tingling that persists, then it could be due to the same causes as numbness, as well as, believe it or not, hypothyroidism.
Ah.
Yeah.
That's good to know.
Mm-hmm.
Hypothyroidism usually is where people gain a lot of weight as opposed to hyperthyroidism where they're losing weight.
Right.
So that explains both numbness and tingling in their relation to pain, and it all has to do with the nerves and the nervous system.
That's right.
Now, are there any situations where not having pain would be a bad thing?
Well, absolutely.
Okay, what would be some examples?
Well, a life-threatening situation like a heart attack usually includes chest pain,
Mm-hmm.
along with shortness of breath and possibly tingling and numbness down the left arm and into the face and jaw.
Mm-hmm.
So just numbness and tingling down the arm and into the face and jaw could just be a pinched nerve. But the chest pain raises a red flag. Again, the red light goes off again to do something immediately. And by the way, if you're obviously having a heart attack, the immediate thing you should do after calling 911 is to chew one full strength 325 milligram aspirin tablet to lower the intensity of the heart attack, and to take a dose of highly absorbable magnesium, preferably liquid magnesium, which could potentially stop a heart attack within 10 seconds.
Wow.
Yeah, so we carry a liquid magnesium in our office, and I found out about that from Dr. Sherry Rogers, who's written numerous books on environmental medicine, and she had in one of her books this form of magnesium, and I've been using it with patients for numerous conditions, and this would be one that would qualify for.
Very good. One thing I can say, because I have used that form of magnesium, is make sure that you balance it with the other nutrients, that you're not just taking a lot of extra magnesium without enough vitamin C and calcium and other things like that, or you can have some problems that'll arise from that.
Yeah, usually it'll loosen your stools pretty good.
Too much magnesium, not a thing that you want to be like out in a concert that's in Carnegie Hall with your tux on with all sorts of people around you and the camera's rolling. Okay, so then...
Well, there's other obvious situations that would be bad if you could not sense pain.
Okay, what are those?
And that would include walking on a broken leg, burning your finger and not taking it off the hot source immediately.
Right.
Kind of like I did when I was a kid. Stepping on a rusty nail, which can cause an infection such as tetanus.
So for somebody with diabetic neuropathy, that could be an actual situation.
Yes.
Because like walking on a broken leg would be highly unlikely that would happen where somebody would have that and not feel any pain unless they had something like diabetic neuropathy, right? Okay.
And then the other thing would be, believe it or not, cancer, which you could actually have for years and not be aware of it.
Wow.
And especially if you have a fast-growing tumor, which you would want to discover in the earliest stages in order to have the best outcome of overcoming.
Right. And sometimes there just isn't any pain. So that's a situation where you're not getting a warning like you would in other conditions.
That's possible, yes.
Okay. Any other ones?
That's it.
Okay, good. Now, what are the most common medical solutions for the different types of pain? And what negatives are there for these solutions, if there is any negative?
Okay, well, the first and most common thing that medical doctors recommend are pain medications, whether they be over-the-counter or prescription drugs.
Right.
So the most common over-the-counter medications are aspirin, ibuprofen, Tylenol, and naproxen. And these all have side effects, even though they are touted as safe and tend to be popped like candy by many people using them.
Okay.
So I'm going to go through each of these.
All of the side effects?
Yes.
Excellent.
Okay. Aspirin is notorious for causing internal bleeding and ulcers. But I learned while researching it this week that it can also cause tinnitus, which is ringing the ears, as well as dizziness and vertigo. And these are symptoms that I treat quite frequently, and I seem to be seeing more and more people having this. So I'm going to start questioning people if their medical doctor's recommending them to do that. A lot of them take it to prevent heart attacks and strokes and things like that. Now, there's other side effects and adverse reactions that you should be aware of with aspirin, and that includes the fact that aspirin can aggravate asthma.
Okay.
It should also be avoided if you have gout or a tendency for gout, since it can raise the blood uric acid levels.
Okay.
And it can also increase the effect of medicines used to treat diabetes, resulting in abnormally low blood sugars if the blood sugar levels are not monitored correctly. Yeah. So I would think that medical doctors would tell people that if they're putting them on insulin or something of that sort.
Right. Well, especially when you have such a tendency of people to be using it quite frequently when it really should be only for very rare instances.
Yeah. All right, let's move on to ibuprofen, which is also known as Advil and Motrin. So this can cause an array of digestive problems as well as headaches, dizziness, and again, ringing the ears. Yeah. Heavy or long-term use of ibuprofen as well as higher dose aspirin can also cause chronic kidney disease. So again, yeah, you were right. You said, that you shouldn't be using it for long-term, or, it should just be used for certain things for short-term purposes.
Right. Yeah. On the rare occasion when it's needed, not as something to rely on.
Yeah. Now let's get to Tylenol. It's also known as acetaminophen. This can also cause a bunch of digestive symptoms, but it's most notorious for being the number one cause of acute liver failure in the United States when taken in one large dose or after higher than recommended doses for every day for several days. Yeah, one way to avoid liver toxicity is also to never take it with alcohol or on an empty stomach.
Good to know.
And if there are signs of potential liver failure, which include yellowing of your skin and eyeballs, which is also known as jaundice, pain in your upper right abdomen, abdominal swelling, and nausea and vomiting, then you've got a medical emergency that requires immediate hospitalization, especially since excessive bleeding and increasing pressure in the brain may also be occurring.
Oh, that's not good at all.
No. Prognosis is best for people who receive treatment within 12 hours. So, I mean, it's like get right to the hospital.
Right. That's because you're having liver failure.
Yeah. And believe it or not, the severity of the liver toxicity or injury that's occurring can also be reduced with a natural supplement called N-acetylcysteine, or NAC, which the body converts to the outstanding liver antioxidant called glutathione.
Okay.
Yeah. So finally, naproxen. And this is also known as Aleve, naproxen, and Midol. This has similar side effects as ibuprofen, and that also includes the increased risk of blood clots, heart attacks, and strokes.
Okay.
Yeah. So again, that probably shouldn't be used long-term also.
No. It's like any drugs. I mean, I'm not going to say a person should never use any drugs. There's very rare reasons for them, but there are reasons why they would be important. Like even when I was in practice, if I had somebody come in that was having a kidney infection and we found that there was a lot of blood in the urine, you don't mess around with that because that can go right into rheumatic fever. So I would always have them go see their medical doctor right away, and typically they'd put them on an antibiotic. Even though cranberry juice can help, you don't want to take a chance. It's the same thing with pneumonia. If somebody's got pneumonia, you don't mess around with it. That's why Jim Henson died, is he had pneumonia and didn't get it treated quickly enough because he thought he could just work through it. So there are instances where it's going to be vital that somebody gets a proper medication, but it's probably about 0.1% of the amount of prescribed and over-the-counter medications that are used that are actually really needed.
I agree. And what you said about kidney infections with blood in the urine, definitely I refer them out immediately, and usually that requires them going to the hospital. If they've got if they've just got some white blood cells in their urine, and we do urinalysis in the office, then they can take cranberry juice along with D-mannose, and that takes care of 90% of urinary tract infections, which are caused by E. coli. And we'll do a follow-up, and if we notice that it's not improving or if it gets worse, we'll definitely refer them out so they can get an antibiotic for that.
Right.
If the over-the-counter meds don't manage the pain, then medical doctors will pull out the big guns, including steroids like cortisone and prednisone, as well as opiates like oxycodone, hydrocodone, tramadol, codeine, and morphine. And other prescriptions that medical doctors use for pain that are off-label for pain include, believe it or not, antidepressants and anti-seizure medications.
Wonderful.
I know. So I'm not going to go into the side effects of all these meds, but instead sum up the fact that they all have major side effects and should be used for a very short time, if at all.
Yeah, and a lot of them can be addictive too. There's story after story after story of someone who had bad back pain and they were taking oxycodone and they got addicted to it. Yeah. And it's not an uncommon thing with the opioids.
Yes, there's a crisis going on now and we're trying to handle it. So
yeah, well, there's an overall drug crisis that's been going on for quite a while.
Now, there's various injections that MDs recommend in addition to cortisone, including spinal joint injections, nerve blocks, and trigger point injections. And if these medications or injections can't control or relieve the pain, then surgery may be recommended. And surgery should always be the last resort after all other options have been exhausted. And you should always question the success rate, any potential complications, and the recovery time for any surgery you are either recommended or you choose to go through with.
Absolutely. Yeah, well, they're in a situation where there's a bad condition going on or they're in a lot of pain and the doctor says we need to do surgery, nothing else will work. A lot of people, when they're in that condition, they're not going to be able to make the best decisions. They want to believe in their doctor. They want to go along with him and they want to do what's going to help get rid of the condition. But some doctors don't really give alternatives a try. And the plant paradox book, which we're going to be talking about in an upcoming episode, it's interesting because this is a cardiovascular surgeon who does heart surgeries. And after he did all of his research, he'd have patients that were like in the hospital for a bypass surgery or something like this. And he could see that they were scared. And he said, do you want to have this done? And they said, no, but I don't have any other choice. And he'd put him on the program, which is a dietary program. And I read that and I'm thinking, wow, this is somebody who's in the hospital for a bypass surgery, which you think you would always want to do, but that's not true.
Mm-hmm.
So it's the same thing for any of the ones having to do with pain. Very, very few of those are really effective, and none of them actually get at what the real problem is. The only times I think that I could see where it would be necessary would be something like a ruptured disc, or a situation like that where you have a part of the disc that's floating around inside the spinal fluid and it's pressing against the nerves and things like that. And there's really nothing else that you can do about that.
Mm-hmm. Yeah, or a tumor growing in there, or like a bone spur that's like a toothpick that's slicing into a nerve. You want to get rid of that too.
Exactly. So now that we've seen the drugs and the surgery, which are not the best solutions at all, what are some of the natural alternative pain solutions that people can use?
Well, let's start with chiropractic.
Okay.
And it has hundreds of studies now showing how effective it is in relieving and potentially correcting pain syndromes.
Mm-hmm.
That's a strong word, but in my 28 years, I've been able to actually help people correct some of their pain syndromes. The most common thing that chiropractors treat is nerve interference caused by spinal misalignments called subluxations. And our adjustments realign spinal vertebrae to reduce nerve interference, which can stop that broken record pain loop that we spoke of earlier.
Right.
Acupuncture is a proven pain reduction procedure that's been around for thousands of years.
Mm-hmm.
And dry needling is an offshoot of acupuncture that has only been around for about 20 years, but its focus is on treating pain associated with specific nerves, as well as trigger points,
mm-hmm.
which are hyper-irritable spots in the muscles that when they're compressed, they not only produce tightness and tenderness on that spot, but also tend to refer pain to other areas, hence the name trigger point.
Exactly.
Cold laser therapy is also an outstanding natural alternative for pain and inflammation, and you can find out more about this in episode 15, mm-hmm. as well as acupuncture and dry needling in episode number 9.
That's right.
It's all kind of coming full circle now, huh?
That's correct.
And also there's many natural supplement remedies for pain that work as excellent alternatives to medications. So I'm going to start with white willow bark.
Okay.
That's actually what aspirin's made from.
That's correct.
Yeah. So it can be taken as a natural painkiller without the harmful side effects of aspirin. And it tends to be found mixed with other natural painkillers, anti-inflammatories, and muscle relaxants. And I have several supplements that I like to recommend that contain it, including Relaxol, Relax-Aid, and Resume.
Okay.
And Resume is made from the same company that makes Cryoderm, which is an outstanding topical pain reliever, similar to Biofreeze. It also happens to contain the excellent natural painkiller called turmeric.
Yes, you've mentioned that before too.
Yeah. So a few other natural painkillers include ginger, wintergreen essential oil, arnica, and capsaicin, which comes from hot chili peppers.
Now, what about things like ice and heat?
Yeah, I mean, you want to use ice right after you injure something and there's a lot of inflammation. And that would be like if you touch it and it's real tender to the touch, that would be the correct time to use ice. Heat would be more for an area that's real tight or tense and you want to relax it. And tight muscles can cause a lot of pain. We can also include massage in this too. Therapeutic massage is outstanding for pain since you can release trigger points and you can release tight muscles that can be pulling on areas causing strain and pain.
That's right. Now, with heat, is it okay to use dry heat or should it always be moist heat?
I've always recommended moist heat. I just think it's safer. Heating pads, there's issues with heating pads. If you're using it for long periods of time, you should never sleep with a heating pad because things can go wrong. You can be seriously burned from that. So you should only use it for short periods of time while you're awake.
Right. And the other thing about moist heat is it's more penetrating, whereas dry heat is only on the surface.
That's correct.
Okay, good. Now, are there any examples you can give of times where you used some of these alternative solutions and saw results with it?
Oh, yeah.
Okay.
So the first one I'd like to share is I had a patient, and this was a long time ago when I was down at Fort Myers in my first practice.
Right.
She was a female police officer that worked the night shift, and she was a single parent. So you can imagine the amount of stress she was under, and she had horrible migraine headaches. And so she was referred to me by another chiropractor in town who knew that I did acupuncture, and he was adjusting her, but she wasn't quite getting over these headaches. And so when I did acupuncture on her, she got relief from that too. But I noticed that she had the best results when she had both an adjustment and an acupuncture treatment the same day. So I called the other doctor and told him this, and he said, you know what, go ahead and treat her with chiropractic and acupuncture the same day. It's totally fine. I got his permission. And after being on a short treatment program, the migraines completely resolved. It was amazing. And just
wow.
Her life was totally changed.
I would imagine so.
Yeah. So another example is, and this one's using the cold laser, is a good friend of mine had a little accident. He broke his ankle and he had to go to the hospital to get it repaired. And I remember getting a call on a Saturday, and he was in still a lot of pain. His pain was between an 8 and 9, even though he had a morphine drip going into his ankle about every 10 minutes.
Ouch.
Yeah. So I came over, I got permission from the hospital to use the laser, and we got the pain down to about half of what it was. And so I actually came back that night after 10 and did another treatment, and we got it down to somewhere around a 2.
Wow. That's impressive.
I know. And the thing is, they were not going to release him until he could function without having the morphine.
Right.
And believe it or not, he got up the next day and it was down to like a 1, and they released him. So then after that, I made house calls for a couple of weeks, almost every night, treating his ankle with the laser. And he healed in like record time. And the foot doctor, when he went back, was amazed. I mean, completely amazed. And it got him back to work in record time. And so.
Excellent. Were there any others?
Yeah, there's one other one. A good friend of mine, another patient of mine, he came in my office in so much pain. I remember his wife trying to get him out of the car, and we actually had to roll a chair to the car and roll him into the office, into the adjusting room.
Yikes.
Yeah. And so there was no way we could do a manual diversified adjustment on him. It was activator. And that's what I normally did on him anyway. And by the time I got done adjusting him and brought him up, he stood up and he was like totally, completely out of pain. It was like he was high-fiving me. He was so happy. But what does he do? He goes out and decides to walk the entire mall. And he came back and he was almost in as bad a shape as he was when he first came in.
Oh, no.
I know. So I had to see him twice that day. So I gave him the advice to never do that again. And, again, he walked out feeling totally fine.
That's great.
Yeah.
Good stories.
Mm-hmm.
Any more?
I'm saving one for the end here.
Okay.
Yeah.
Well, then, is there anything else you'd like to say before we end this episode?
Yes. The worst type of pain is arguably psychosomatic, in which you have no control over it since it occurs in present time due to a restimulation of something painful that happened in the past.
Mm-hmm.
And it's really frustrating because you're totally the effect of it, like a puppet, since you have no idea why and how it's occurring because there's no apparent physical cause.
Right.
So this is called an engram, and it's due to a moment in time in the past in which you experienced pain and unconsciousness, such as an injury like a concussion from an auto accident or sports injury, or something like a bad fall or even a surgery.
Mm-hmm.
So fortunately, there's a simple and workable solution to this, and it's found in the most widely read and influential book ever written about the human mind called Dianetics, The Modern Science of Mental Health by L. Ron Hubbard. And I'd like to give you an example of how I use this technology in the book to help a patient of mine.
Mm-hmm.
So about 25 years ago, one of my patients had an auto accident in a parking lot, which included her receiving a concussion from whiplash in which she hit her head on the steering wheel.
Mm-hmm.
So she developed severe migraine-like headaches as well as a heart condition in which her medical doctor said her heart actually went into shock and never fully recovered. Yeah, I've never seen anything like this. So After a couple months of standard chiropractic and physical therapy, she was not improving in a timely fashion and was very concerned and anxious about her condition. Well, she gave me permission to take her back to the same location of her accident in her car, and I had her go back through the incident of the accident numerous times with her in the driver's seat, and she essentially re-experienced all of the physical and mental parts of it.
Mm-hmm.
And the various pains and emotions turned back on again as if she was re-experiencing everything as if it was happening again, and they eventually disappeared, and she felt significantly better. In fact, her headaches cleared up and did not return, and she even went back to her medical doctor, and he rechecked her heart and said that her condition completely resolved.
That's great.
I know. So this totally changed her life, and she really thought nothing could be done about it. And as an aside, her daughter was so amazed at all this stuff that she went on to become a chiropractor.
Wow.
Yeah.
That's very cool.
Yeah. So I guess we can add this to the list of alternative treatments for pain, even though it's not designed for physical pain, but rather for pain resulting from buried memories.
Excellent. That sounds great. Anything else you'd like to share?
I think that'll do it.
All right. Next week, we're going to move on to another topic it's a similar subject, but it's different. And that has to do with headaches, which has to do with pain, but it's a lot more than just pain. And there are different types of headaches, and we're going to go into the different types, what causes them, what can be done about them other than painkillers. All right, Steve, thanks again.
You got it, brother.
Thanks for joining us this week on the Body Chat Podcast. We both really appreciate your time and your attention. We want to provide you with interesting and informative episodes each week, and if you have a topic you'd like us to cover or any questions you'd like us to answer, send an email to us at info@bodychatpodcast.com. That's info@bodychatpodcast.com. To make sure you don't miss any of our upcoming episodes, subscribe to the Body Chat Podcast now on iTunes, Stitcher, Google Play, or Spotify. See you next week.